Master Builders Association. I wanted to just do some quick housekeeping for you. Everyone who is our attendee with us today, your microphones are on mute, so we want to get those questions in the question box answered for you. Go ahead and put anything about the benefits and your business questions in that question area. If you have any technical questions, go ahead and pop that in the chat box and we will address them as they come in. I do want to let you know, we are going to record this presentation and we will get it up on our website. We have a COVID website, an MBAX COVID website that you can find by going to our regular MBAX webpage, and there's a new tab up there where you can click on specific information regarding updates around COVID-19. We'll upload any of the documents that we have available, and then any Q&A, FAQ, things like that, we will address the questions and make the resources available to you as quickly as possible. And then you can always reach out to our team. And so speaking of our team, I'd like to introduce Kevin McDaniels of Master Builders Association. Kevin, go ahead and take it off.
Thanks, Gina, and thanks everyone for joining us today. As Gina mentioned, I'm Kevin McDaniel. I'm the product manager here at the Master Builders Association, and hopefully this is useful and answers a lot of the questions that you might be having. With us today, we've got Chris Gorey with Capital Benefit Group, representing the MBA Health Insurance Trust, and Chris will be providing a presentation for us all today, and then there sometime at the end for questions. So as Gina mentioned, please enter any questions that you have into the question box. We'll get to as many of those as we can at the end, and then Chris might be answering some of those offline as well. So Chris, take it away.
All right, Kevin, thank you. Gina, thank you. So first of all, everyone, this is Chris Gorey. I'm at Capital Benefit Group. Our subsidiary companies are Capital Benefit Services and EPK Benefits, and we are the best way to describe us is sort of the intel inside. We're kind of behind the scenes supporting the operation of the Master Builders Association Health Insurance Trust. What I wanted to get to today was to talk through a lot of the points that we laid out in an email that went out to all participating employers back on Friday, March 20th. So a week ago Friday, we sent out an email regarding this topic. And hopefully we can get into some of the details here and help answer some of your specific questions along the way. Before I start, I guess I just want to express my acknowledgement, my compassion, understanding for what everyone is going through in these unprecedented times. We know there is obviously a significant impact on you all and your businesses. We are feeling it ourselves. We feel it directly. As your businesses go, so do we. And so I fully appreciate all the considerations you have with work shutdowns and potential considerations for layoffs and furloughs, and hopefully we can walk through what your options are, and hopefully put you in as good of a position as possible to deal with these uncertain times. So with that, I'm going to dive right in, and I'll roll through these slides. There's really only 5 or 6 content slides, and then we'll get into the more fun answering some Q&A. Actually, so before I jump in, for our hosts, for the MBA hosts, do you see that there's a few questions out there where people are saying they can't hear? I don't know if there's any guidance you can offer.
There is some advice in the chat box if we can get any of the technical questions over there. We do have somebody who can help guide depending on what's going on.
Yeah, just to chime in, if you're attempting to listen to the webinar via a PC and your audio is not working, I advise you listen to the audio on your telephone. If you'll look down in the chat box, I have posted the phone number you can call and the access code that you need to get into this particular webinar. Other than that, those are really the 2 options we have. The phone is pretty reliable. So if you are having trouble with your computer, I would just advise to call the phone number.
And I do see a couple of people that would like to probably use that tool. So just to give them about 30 seconds to a minute to dial in and get that going. I do want to point out, we do have a live handout. If you all look in the handout section, you can download what we're going to go over here live, and you can have that on file to share and use as a reference if you'd like. We will also make this available either via email and or via the COVID MBAC's website after the presentation as well.
Okay, I'll hang tight just a few more seconds. Hopefully people are, oh, I see some thank yous, so I think that might be,
I think it's working.
hopefully the sound is working. If they're, yeah, switching over to phone is always best. Great.
All right, thanks, Chris.
Okay. All right, so here we go. We'll be off and running. I'm going to jump into slide number 2. I want to be sure that that's switching. Yeah, good. You all should be able to see this slide. So a number of employers have called us and just wanted to explore what are all their options. And so before we get to layoffs, I wanted to just offer these alternatives that could be some cost control mechanisms. The first, if you want to reduce your employer contribution, in terms of that's the share of premium that you pay versus what your employees pay, you may reduce that mid-year at any time. You just simply have to let us know, let your EPK administrator know that you're reducing your employer contribution. The lowest you can go is 50% of the employee cost. That's the minimum in order for these plans to be considered a group health plan. So you may do that. You can reduce your contribution. The next point is some of you may have your eligibility requirements up at maybe 30 hours a week, and you might be saying, I'm going to reduce hours for my employees, but I want them to be able to keep benefits. So again, you may reduce your definition of eligibility down to a minimum of 20 hours per week. And in a second, we're going to get into, well, what happens if my employees fall below that 20-hour threshold? That'll be a separate consideration. We'll get to that in a couple of slides. And then the third point on here is you may be saying, I want to continue offering benefits to my employees, but I need to find a way to reduce the costs associated with all of this. And so mid-year, you may reduce your benefits. We have several plan options. You could contact your EPK administrator or your sales representative and look at lower cost plan options. What that usually means is increasing deductibles or increasing co-pays, other factors. But I wanted to at least put that out to you first, that there are some other options to try to reduce your financial exposure before we get to layoffs. So that's step one. The next step in our discussion, the next step is, well, I get a call that says I need to lay off a number of my employees, X percentage of my employees. What can we do? What's the impact on our benefit plan? And what I deliver back to every employer is that depends entirely on what it is that you are trying to achieve. Some employers are telling us, I want to maintain the benefit program for my employees. I would like to keep the employees on the benefit plan for as long as possible and continuing to pay for it and so on. Option B is, I'm sorry, I don't have any money. I have no revenue. I need to not only lay off my employees, but I also need to stop paying for their benefits. I need to fully terminate them from the benefit plan. So those are two different streams that we will go down. And I'm going to walk through these two scenarios. So in the first scenario, we are laying off employees for a short period of time with the anticipation that these employees will be coming back to work when we have work again for them, right? So all of what I describe this as the layoff or furlough or standby, where the employer is maintaining the benefit package for their employees, for their furloughed employees. All of our contracts have a leave of absence provision, and all of the carriers, whether it's Regents, Assurus, Kaiser, Delta Dental, LifeMap, all of the carriers involved in delivering your benefit programs have agreed to honor this leave of absence provision as the vehicle to use to keep people on benefits. So here's how this works. If you as the employer furlough an employee, but you tell us when you're managing your eligibility with us that you want to keep that employee on the plan, you may do that. You may continue to keep them on the plan for up to 90 days. And you all know how the benefits work. It's really 90 days, and then from 90 days, the benefit plan continues to the end of that month. So for up to 90 days, as long as you, the employer, are continuing to pay the premium, that person will continue to be eligible for their benefits. In the example, we talked about this in the prior slide. If somebody's hours drop below 20 hours, somebody's working 5, 10, 15 hours, we are honoring the utilization of this LOA provision. So we know that their eligibility, they have fallen off of normal eligibility. But during this time, this unique time, we are going to keep the LOA provision active, again, for this 90-day period to allow you to keep those employees on the benefit plan. Third point here is that all of our lines of coverage, I said this a second ago, all carriers, all lines of coverage will honor the 90-day leave of absence provision. And the way this works, just as you do today, the employer to us, when you pay for the premium contribution for the trust, the employer is always paying the full premium amount. I know that behind the scenes, you are doing something else with your payroll system where you are deducting a share of those dollars from some employees. It might be employees with dependents. Could be that you're taking maybe 25% of all employees. There's various premium share arrangements between employer and employee. But we at EPK, that we handle the billing and collections and so on, are not involved in that step of the process. So this always becomes a question. I'm the employer. If I've furloughed my employees, there is no payroll for that period of time. How should I go about collecting my employees' share of the premium that we would normally collect from them? And again, that is entirely 100% up to you. Some employers will go through a process where they are literally collecting checks from their employees in advance of the premium period to be sure that your share of the premium is as you expect it to be for each of those months. Some other employers may choose to defer the employee's share until such a time that the employee comes back to work, and then configure some arrangement where you can recoup those premium share contributions from the employees. But again, that is entirely up to you in how you manage that premium share arrangement between employer and employee. All we care about is that the employer is remitting the full premium amount to the trust. Okay. So I'm going to keep, yes, please.
Quick question that is pertinent to the timing on this. How does this apply in regards to a standby employee?
Same way. Yeah, so I should have up at the top of this said layoffs, furlough, standby, shared work provision. I think that's another term that is thrown into the mix. All of those different statuses all work exactly the same.
Okay. And then there's another question that's right on line with what you're talking about right now. I just thought I'd throw in there. Does
Yep.
this mean the employer portion is something that would be given back, like a tax credit? That one's from Brittany.
Oh gosh, the employer portion is something that would be given back like a tax credit.
Is it kind of two portions? Is it something that could be given back? And if it is it something like a tax credit, or how would that work?
I'm going to need to take that one offline. I'm not familiar with any programs where the tax credit is coming back. I think this is probably related to the new federal law. What is it? The Coronavirus Protection Act, where the government is reimbursing small businesses during standby status. Yeah, I would. So I know one of the pieces that is reimbursable is salary, right? Salary and benefits. So in theory, yes, the employer share of benefits would fit into that reimbursable, taxable credit. But this is a case where I would want to defer to your employment law attorney or your tax attorney.
Are you referring to potentially the Family First Act that we?
Yes, thank you. Yeah.
Yeah, no. Okay, that was all I had that was in line with what you're doing there. Go ahead.
Okay, great. Well, I'll keep going then. So the next scenario is if you're in a position where you are laying off employees and you do not want to continue employer paid benefits, right? So, or you cannot afford to. In that case, there are multiple options. The first option that everybody looks at is always COBRA. So all of our plans are COBRA eligible. So the plans that you have within the MBA Health Trust, and I recognize some employers may have, for example, medical through the health trust, and you may have a dental plan outside of the health trust directly with another dental carrier. I am speaking specifically about the plans within the health trust. Your other plans may or may not be eligible for for COBRA. So first point on COBRA is COBRA is only available if the underlying plan is still active. So in the case where an employer terminates coverage entirely for all employees, meaning nobody else is left on the plan, that plan goes away and COBRA is no longer available to anyone who was previously on the plan. So our recommendation in this case is if you do want COBRA to remain available to your laid off employees, you must keep at least one employee active on that plan. And it's usually the owner will keep him or herself active on the plan, keeping the plan alive, keeping the plan active, whereby COBRA can then be offered to every terminated or furloughed employee. The alternatives to COBRA are, it really depends on the individual person's circumstance. There are individual policies that are available in the market. Those are for people under age 65. There's AppleCare or Medicaid, and Medicaid has its own calculation for whether a person is eligible. It's based on their total earnings in the prior year. But our team can help somebody navigate whether AppleCare would be an option for them. And then lastly, of course, there's Medicare plans are also available. Now that's only available to individuals over age 65. But I lay out these alternatives because often, depending on the age of the individual, it may be feasible to find a lower cost catastrophic protection or the lower cost option through the individual market rather than taking on a COBRA plan. So our team will work with each person to try to help them find the right policy for them to meet their needs. And then my last point on this slide, question we always get is, well, in my group health insurance policy, we have a waiting period for new hires. Maybe it's 60 days or 90 days. So if I lay somebody off and then bring them back, can I put them back on employee benefits immediately? And the answer to that question is yes. If you have a rehire policy that waives the waiting period or that probationary period for rehires, that's a different category than new hires. If you want to waive the waiting period for rehires, you may do that, but that time frame, they must be rehired within 6 months of the original termination date. I know we all feel this way. I certainly hope that we will be back up and running and hopefully full speed within that 6-month time frame. So let me pause on that slide to see if there are any questions on this that popped up.
Initially, we did have one from Jamie. If all employees are COVID furloughed and can keep paying their insurance and not switch to COBRA until we start back up again?
Yeah, so that scenario, I would go back to my previous slide. That looks more like this slide. You would essentially be using the leave of absence provision. I put that in quotes because you use the term that all of your employees are COVID furloughed. You're furloughing them because you don't have work for them. You could also use the term standby, and I think that's what you're getting at, that you don't have work for them now, you're putting them on standby, but you are going to keep them on the benefit plan. Yes, you may do that as long as it is only for a maximum of 90 days. If we go beyond, go ahead.
She won't have any employees active and can keep paying the premiums for everyone until we return to work. And she says, hopefully within 90 days.
Yep, that's exactly right. Yes, all of that. Nope, nobody would be technically active. Although to us, I understand what she's saying is she won't have any real active employees. To us in the health trust, they will be treated as if they are active employees. That's what the leave of absence provision does. We all acknowledge, we're looking each other in the eye saying, I understand this person is not working, but we are going to treat them as an active employee for the next 90 days. If this goes past 90 days and they are still not working, then unfortunately we have to flip to this slide. And at that point, we can't keep them on as pseudo-active anymore or leave of absence anymore. They would, after 90 days, they would have to be converted to either COBRA or some alternative.
Okay, I do think that covers. She says, do I need to go back and put them, and put that they are furloughed and that they claimed unemployment or lack of work? Hopefully these questions are something that everyone's also facing as well too.
Right. No, these are great questions because we're fielding these by the ones in our office. So for the leave of absence provision, we are not requiring any sort of documentation. Yes, you will want to maintain your own documentation that says these employees were furloughed on this date, but you don't have to give us a notice that puts them in a separate status, so to speak. For our purposes here at the Health Trust, they will just continue on as an active participant in the Health Trust. And for what it's worth, in general, and I'm going to defer to a tax attorney or a HR law employment attorney, but generally speaking, the availability of benefits is not a determiner of unemployment benefit status. So you may continue, in this case, you may continue to offer your employee benefits, your medical, your dental, and so on, and that person may continue to receive their unemployment assistance from the state or federal government.
Okay. There is a question, after 90 days, can you bring them back on for 1 day and then lay them off again to reset the 90 days, or is it a one-time 90 days?
Is a great question, and I don't know. I'm going to have to get back to you on that one. That's a great question.
Okay. And does life insurance stay in effect as well?
It does, yes. That was, thank you. Whoever asked that question was probably looking closely at our email. We were waiting on this guidance from LifeMap, and they finally did come back to us last week, and they confirmed that they will also honor the same LOA provision. So all carriers, all coverage lines within the trust will honor the 90-day leave of absence policy. Okay.
Okay. And then I think we can just move. I'll keep asking as we go. We do have good questions coming in, but we'll let you move forward a little bit, and then we'll go back and cover some of these.
Great. So I'm going to click onto the next slide. Hopefully that comes through. And I think this may be my, yes, this is my last slide. So we also get lots of questions about premium payment and what are we doing regarding late payments, et cetera, and grace periods. So the first thing to understand about health insurance programs is all fully insured health insurance programs are prepaid health insurance. So for your March coverage, when we have your 20 employees covered for the month of March, for their medical bills for the month of March, the premium for that March coverage is due on March 1st, at the beginning of the month, right? Prepaid health insurance. For many years, we have had in place a 30-day grace period has been honored. What that means is while your due date is March 1st, as long as you pay by March 31st in this case, your coverage will remain active and will roll forward to the next month. You'll receive those delinquency notices and so on. What just happened last week was a requirement by the Washington Insurance Commissioner that we honor 60-day grace periods. So we will be doing that. 60-day grace periods mean your March 1st payment still due on March 1st, but that delinquency may continue all the way up until April 30th. Let me go. I'll go through the slide. We encourage all of our clients to pay their bill online using the EP Connect system. We have also updated the EP Connect system to allow any employer to modify the payment amount. There had been an issue previously where once you got into a delinquent status, you would have to pay 2 months worth of premium, right? You would have to pay your March, and we've now already billed for April. And so your March and your April invoice is due. That's still true, right? Technically, your April 1 due date, that's due in 2 days. And we have some clients that still have not yet paid March. What our new system will allow you to do is go into the billing system.
Chris, I think we lost you. Chris, you're breaking up.
Is faster and more secure way of payment rather than submitting checks. One thing that I want everyone to understand is our office building, the office building that we are in, the front doors have been closed and locked by the building administrator, by our building management. So the ability to come into our office and drop off a check is limited. So we're encouraging everyone to go online. And then the last point in here is, well, what exactly does this mean? If an employer takes advantage of—
Hey, Chris.
Yep. Yes.
You broke up a couple bullet points ago, so people are asking if you could just roll it back a bit. You're coming through loud and clear now.
Okay. Sorry about that. Sure thing. Where was I? So main point of this slide is that the grace period for your payment due has been extended out to 60 days. So your March 1st payment, if you haven't paid it already, of course we hope you have, but if you have not paid it already, that payment must be paid at the very latest by April 30th. We also encourage all of our clients to pay online. It's the most secure and most direct way of getting your payment to us and ensuring that your coverage continues for you and your employees. And the online system will now allow you to modify the payment so that you don't have to pay a full 2 months at one time. You can break it down and catch up paying 1 month at a time.
Hey, Chris, can people schedule a payment for a future date?
You cannot. The system does not allow. Yeah, that's what I do when I'm paying my credit card bills. I always set it for the very last date. Unfortunately, our system does not allow you to set a future date payment.
If someone has already mailed a check and so we are kind of in this pending time and it's in the mail, is there anyone at your office that could receive it?
Yes, we do have people here that will receive checks and post them. We have people coming into our office. Right now, they are coming in Monday, Wednesday, Friday for exactly that purpose, to process checks. And so, like I said, you can understand why we are trying to encourage as many employers as possible to use the online system. But yes, we will receive your mailed check and process.
One last pertinent timing thing here. So since Wednesday is the 1st, how long do they have? Does it basically till midnight on the 31st to make the status changes as necessary?
To make the status changes as necessary, I think.
Load laid off, that kind of thing.
Yeah, when people are laid off, they actually have until the 10th of the next month to inform us of those changes. The reason for that is our billing cycle. So on the 10th of March is when we sent out the April 1st invoice. So on the 10th of April, we will be sending out the May 1st invoice. And if an employer needs to go back and inform us about somebody who has been terminated or laid off from the plan, they need to get that information into us prior to the 10th of the month so that we can process the adjustment to the prior month and roll that forward for them.
Okay. Those were the timely ones right now.
Great. So on this point about 60 days, I just want to lay out an area that we are still unclear on. And I know this is really important for all of you who want to be sure your employees have coverage. Think through this now with me, that I already said that your March 1st premium was due March 1st, but technically you just need to pay it by April 30th. But we're sitting here now, what is it? It's March 30th today. What happens if you don't pay by April 30th? What happens if you never pay? The carriers will terminate the group and all the participating employees all the way back to March 1st. And this is the shame of the process, the way the process delay affects individual employees. The employees think they have coverage right now, and if the premium isn't paid, they then later find out, oh, you went to the doctor on March 30th and you actually didn't have coverage. So one of the things that we're waiting on is how are the insurance carriers going to operationalize this requirement to extend the period out to 60 days. We still do not know yet, but we will be sending out communications once we receive it. Is all the eligibility going to be pended, meaning you're not in an active status, you're in a pended waiting for payment status? Are claims going to be pended? Will doctors know that this person has not had their insurance paid for yet? All of those questions are still up in the air. And for those of you who have seen the communication about a 60-day grace period, I want you to understand that there are implications on how that is operationalized within the insurance system. And I already made this point about if you don't pay March 1st premium due by May 1st, the group and the employees will be terminated back to February 29th. Okay. These were the sort of the key points that I wanted to lay out. I know that now we probably want to get into some specifics. I wanted to just open this up for any Q&A. Mm-hmm. You see my disclaimer on here that I am not an attorney. I'm not offering legal advice, so I can't offer HR or employment advice, but I can give you direction on benefits.
Okay, I'm going to go from the top here as they were coming in as we started talking, and we can address one by one as they come in. Is there a way to keep employees who may be on unemployment on the MBA health insurance? Is there an overlap possible? And can it be combined with any other of the COVID relief programs that are coming out?
So employees who have been laid off by your company, mm-hmm. who are receiving unemployment assistance, yes, those employees can stay on if, using the leave of absence provision, they can stay on for 90 days as long as the employer continues paying the premium due for that employee. Again, the employer is in charge of managing their own eligibility on their plan in our systems.
Is there any overlap possible or any other programs that you know of with the COVID relief programs that would also apply at the same time?
So my understanding is that employee benefits, the MBA Health Trust, any employee benefits are mutually exclusive to any other employment assistance program. So whether it's receiving unemployment benefits, completely mutually exclusive. You can have both running concurrently. Any of the small business loans that have come out from the federal government, any of those support features, all of those programs are eligible to you. And your decision on what you do with employee benefits are mutually exclusive. The exception to that is some of those government assistance programs call out explicitly that they require you to continue paying for employee benefits. The best example of that is the shared work arrangement. For the shared work arrangement, which I understand is a reduction in hours and sharing a single role with multiple people, That shared work arrangement requires that the employer continue serving benefits, employee benefits, to each of those employees as if they were previously full-time. To the contrary, standby provision does not require, it doesn't say anything about an obligation to offer employee benefits to those employees who have been put on a standby status.
Okay, I think that well addresses that. Is there a formal method to notify EPK that an employee is out on a leave of absence, or is this an internal record keeping piece?
It really, thank you. It really is an internal record keeping piece for the employer. If you want to send an email to your EPK representative who normally provides you with your support, that's certainly welcomed. But the management of eligibility on your plan is your responsibility. You tell us when somebody's hired. You tell us when somebody's terminated. You tell us when somebody should come on the plan, off the plan, and you will manage your own internally, your own leave of absence status over time.
Okay. Can they raise the contributions back up when this is over mid-year?
Great question, and the answer is yes.
Perfect. Let's see here. What if we don't have a rehire policy? Can we add one now?
Yes, thank you. That's exactly right. Send an email to your EPK representative and say, hey, we're furloughing these people, and I want to be sure that I have a rehire provision. Here's what I want it to be. And it's that simple. That we do need documentation of. Just an email is simple enough. It will suffice.
Sounds great. What if some employees are furloughed and some can work full-time from home?
Yes, so now we're walking into employment law, but so your employees who work full-time, who are still working, would still be on the plan as active employees. Your employees who are furloughed, you would not be paying them their normal salary for that period of time, or their normal compensation for that period of time. But to us, for that 90-day period, we would be treating them exactly the same at your direction, right? If you want to keep those furloughed employees on benefits, this is utilizing the leave of absence provision, we will allow it and honor it. If you don't want to, that is also your prerogative. But here's one thing that we do need to be consistent on. You can't pick one furloughed employee to keep on benefits and another furloughed employee to roll off of benefits. You have to apply a leave of absence or standby or furlough. Any of those have to be applied consistently among those employees who fit that status.
So then that would apply. So this kind of tails into another question we have from someone else where it says leave of absence applies to all employees on the plan. Is the answer yes with consistency?
Yes, it does. Right. Yes. You can execute a leave of absence provision for any employee on the plan, but you cannot be selective about it. This is where now I'm coming so close to talking about employment law, but you start getting into your discrimination provisions. If you're worried that you're bumping up against discrimination provisions, I would encourage you to speak with a employment attorney.
Good advice. Good advice. If someone has an employee that's halfway through the waiting period for eligibility, and then once they return to work, are their days retro as far as the time they worked beforehand?
Yes, this is a great question. This has come up just here this month. We've had some employers say, hey, April 1st is coming, and I have an employee who we hired January 1st. They've just passed their 90-day waiting period. They should be eligible for benefits right now, right, on April 1st, but they are not actively at work because we just furloughed them for who knows how long, right? In this case, you cannot add a person to the plan if they are not actively at work. So everything that we've just talked through here is related to employees who were already on the plan and what we do with them going forward. In this case, we've got the new employee who's passed their 90 days, but they're not actively at work. What we are doing is we are essentially pausing the waiting period while their work is paused. So let's assume that person comes back to work. Let's say it's sometime in the month of June. That person has already passed their waiting period. We are unpressing the pause button, and they will pick up exactly where they left off. So that person that, let's say June 10th is when they come back to work, they will be eligible for benefits on July 1st, right? The first of the following month. So I think that example covers that question. I don't know if there's any more that I should explain on that.
I will let Jennifer Hansen elaborate in a question in the question box there if she has additional follow-up on that. Let's see, another one here from Kathy. Part of the shared work requirement is to keep health insurance. What happens if they are on shared work past the 90 days?
Oh, yes, thank you. That's a good question. I know I threw them all into the same bundle. Shared work, this only becomes an issue if the two people that are sharing the work both drop below 20 hours, right? So my gut response to that, and a lot of these provisions that we've put together are short-term in nature, assuming that we get back to business within a 90-day period. If that happens, if shared work continues more than 90 days, I think we will have a very, very strong argument to go to the insurance carriers and say, hey, we recognize that these people in this status, the shared work status, have fallen below 20 hours. They've been below 20 hours for more than 90 days, but they are explicitly in this shared work status, which was a government-defined status, work status, specifically for this environment that we're in. And I think what will happen is the provision will be modified to allow those people explicitly to stay on as active employees. In other words, that 20-hour threshold will probably would be modified to say it's 20 hours, or if they're under 20 hours and operating in a shared work status, that it would be appropriate that those people stay on as active employees. That's my 2 cents for right now, without a firm commitment on that.
Okay. Can you go over waiving the waiting period information for rehires again?
Sure. The first thing is, I don't expect you all to remember this, but in your participation agreement that you signed when you first came aboard with the trust, and that you sign every year at renewal, we have you re-sign it's called a PA, a participation agreement. And inside the participation agreement, there is language in there that asks if you have a rehire provision. If you want, well, first of all, it says, what is your waiting period? And then secondly, it says, do you have a rehire provision that is different than your normal new hire waiting period. I wouldn't be at all surprised if many of you have not filled that piece out and said, that's not relevant to us, left it blank. That is okay. We just need you to notify your EPK representative that you would like to enact a rehire provision. And the rehire provision essentially would be, all you're saying, most rehire provisions are, if an employee is terminated and rehired within 6 months, that's the maximum. You could change it. It could be less than that if you wanted, but I think for this discussion, you're going to want it to be 6 months. If somebody is rehired within 6 months, then our waiting period is voided, and we skip the waiting period, and the person is brought onto the benefit plan immediately the first of the following month. But to be clear on what immediate means, it's always the first of the following month. I hope that that's clear enough. It's a very easy policy, and we just need to document it in our systems that that's your employment policy for all. That has to be applied to all rehires in that time period.
Okay. If Amy has any further details she'd like, I'll let her ping that in the question box here.
Sure.
How long is the grace period? How long does this grace period to pay bills late last?
Thank you for that question, because that is a great unknown. And I'm sure you're thinking through, wow, what if I wait, if I don't pay March until April 30th? Sorry, let me give you the explicit answer. My understanding is that the governor put this, or I'm sorry, the OIC, the insurance commissioner, put this in through March 22nd or May 22nd or May 23rd. We will be honoring this for the March billing period, the April billing period, and the May billing period at the least. So March, April, and May invoices will have a 60-day grace. Following that,
Ooh. I think we might have had some audio issue real quickly with Chris. Can you repeat that last couple sentences there, Chris? I think we might have lost you for a moment. Are you there, Chris?
May 1 and June 1 invoices due. So that at some point in time that will happen, but we will respond to the guidance of the insurance commissioner on when that should take effect, and it's going to be a function of when business gets back to business.
I think we dropped you a little bit in there. Could you possibly go back just a little bit to what you just said? The 60-day grace period will be applied to the March, April, and May invoices. And then just after that, we lost a little bit.
So I'm certain that we will honor 60-day grace for March, April, and May invoices. After that, I don't know. If everything returns back to business, I won't say as usual, but more of a normalized business environment, my expectation is that the June payment would revert back to a 30-day grace period. And if that is the way it plays out, then it is feasible that by June 30th, you would have both your May payment due on a 60-day cycle and your June payment due on a 30-day grace cycle. So just do understand that at some point we will revert back, and so if you're utilizing a 60-day grace now, there will be a time when you will be paying 2 months of premium to catch back up. Hopefully that's at a point when our business has returned to a point that we can sustain it.
Okay. And does the grace period to pay the premiums late apply to people on COBRA as well?
Good question, and I think the answer is yes. I am 99% certain the answer is yes.
Okay. And then does the leave of absence 90 days start April 1st or April 15th?
Leave of absence, 90 days. Actually, we are starting that now. It's in place now.
Okay. And then if one of the employees gets very sick from COVID or for whatever reason while they're out, do they stay covered even if they cannot return to work ever? Do I need to keep paying the premium forever?
That is a great question. I'm pausing. Somebody is indefinitely on leave.
If recovery is taking either an indefinite amount of time or very, very long, potentially forever.
Yeah, I don't have a good answer for you. I know our EPK leader will. I'm sorry. Yeah, I don't know.
Okay, we can follow up with some of these later. That's totally fine. As far as raising back up the contributions mid-year, how often can we change or alter our contributions? Is it every quarter, every month, or other?
Yeah, technically it's every month. Yeah, let's just go with that. We know we're in unusual times right now. It's very rare that employers come to us with those types of changes in sort of a normal business cycle, but technically you could change that every month as long as you stay above your the 50% minimum, like I said. Part of the reason I'm not concerned by saying you could do it every month is you would then need to explain those changes to your employees every month, that you're changing their payroll deduction. And I know that's going to be very unlikely.
Wouldn't potentially, actually, this is a good feedback on the person who might be sick, quote unquote, potentially forever, is that would they eventually just want to go on to disability at that point, maybe, rather than still be part of this program?
Thank you. Yeah, well, and this is where I'm pausing and why I was uncomfortable giving a succinct answer, is because there are other provisions. Once somebody goes more than 90 days out of work, what usually happens is some other provision comes into effect. And so, yes, it would be more likely that they would go on a long-term disability provision. But then you have the question of, well, what if they don't have a long-term disability plan? So there are a number of factors that come into play. And that's why I didn't want to give a firm response to that. I do want to follow up to that one at a later date, and then probably in writing.
Okay, sounds great. We've covered high level everyone's questions at this point. It looks like we are exactly on time, which is fantastic. But I do want to let everyone know we are not done answering questions. Chris would be happy to help. Our team would be happy to help at MBAX. And then we are going to be able to make this recording available online in a couple of hours as soon as it's available to us. And we will be happy to field any questions there. If you do see on your screen, Chris's email is there. Please follow up with that, and then we can make a document out of the questions that came up here that we addressed in this webinar. If there's any other questions, go ahead and pop them there in the question box, but I'll let Chris kind of wrap this up for us. Any other stuff you would like to add at this point?
Yeah, thank you, Gina. I really didn't. I hope this is helpful. I really do feel for what all of you are going through, making really difficult decisions, trying to understand how all this unprecedented time is affecting you and your employees. So please do contact us. our entire team is here to serve you all. Contact your EPK representative, contact me directly. We are here to help, and if we don't have the answer for you immediately, we will hunt it down on your behalf.
Absolutely. Thank you so much. I do want to let everybody know before you jump off that we do have another unemployment webinar happening on Wednesday, April 1st at 11 a.m. So go ahead and go to the MBAX events area on the website and register yourself for that. It is free to Master Builders members, and there's some really great crossover information about insurance and how it affects your participation. And with that, I just want to thank everybody for being on here, and have a great afternoon. Stay safe.